Flagler's medical tenant representation team assists medical systems, multi-location medical practices, as well as single physician operations in successfully renewing or relocating their operation throughout the state of Florida. We are experts at understanding the needs and key drivers of distinctive medical specialties, assessing existing locations both from a real estate and a medical standpoint, and negotiating and securing the best conditions for our clients. Our tenant representation services include a number of analytical options, such as evaluation of existing locations, search for optimal locations for expansion or relocation, competition analysis, demographic, healthcare environment and psychographic analysis, audit and renegotiation of existing lease agreement, buy versus lease analysis, sublease or space sharing, and leasing risk and liability analysis. Among the many advantages to you, we would like to highlight the access to a proprietary and wide-range database of medical offices and facilities, access to a permanently updated and state-of-the-art database of medical information originating from American Hospital Association, U.S. Census, Healthcare Cost Report Information System, NPPES, and many others. Free of charge service, as our compensation is typically the responsibility of landlords, and utmost confidentiality. Our tenant representation methodology follows a three-step process. Step 1, strategic planning. Step 2, selection, negotiation, and execution. Step 3, project and move management. As an illustration of our capabilities and process, let's study the fictitious case of a pediatrician's group. In order to rank various areas, we use the delta between the supply of pediatricians and projected procedures performed by those pediatricians. We combine this data with the volume and growth of procedures, as well as pediatric office visits, access to medical care and pediatrician need, current and projected, for the year 2016. Using this ranking methodology, we can grade this practice's existing locations. All locations rank very high from a medical environment standpoint. Out of a maximum of 10, they average 8.8. Overall, this means a high and growing volume of visits and procedures, easy access to medical care, and a low need for additional physicians. To compare, Miami Children's Hospital satellite locations average 9.1 on the same scale. Let's now consider another area where this practice might create a new care center, Palm City, south of Jupiter in Martin County. Using our real estate databases, we identify the Palm City Professional Center as a new potential location for this pediatrician group. Palm City Professional Center is a 15,000 square foot building. It is located 2.5 miles from the Florida Turnpike. There are 6,200 square feet available in the building, ample patient parking, and outside signage is an option. It rates 8.2 B+ on our scale, reflecting a high volume market as well as a high need for pediatricians. The 10-mile radius around Palm City Professional Center had 105,000 pediatrician office visits in 2011. By 2016, this number is projected to reach 114,000 visits, indicating a 5-year growth rate of 8%. This area could currently support 4.75 additional pediatricians. If no new pediatricians enter this service area by 2016, the Palm City Professional Center could support 6.63 additional pediatricians. The immediate healthcare landscape for this location includes St. Lucie Medical Center, Martin Memorial Medical Center, and Martin Memorial South. We can access income statements, balance sheets, and other data for each one of these hospitals. We might also want to look at data such as demographics and economics. We have access to information including the total number of households current and projected, the population current and projected, the median household income per age, the median household wealth, gender, population under 18 years old, population annual growth rate, ethnicity, income, household value, household wealth, as well as age and education distribution. We can also plot ambulatory surgery centers or pediatricians in the area and export their contact information for future use. Psychographics can also help this pediatrician group better market its services to the community. Here we see that the population belongs mostly to the group called Sunset City Blues, a middle-class status heavy on leisure and recreation. We can create thermal maps to assess the competition regarding pediatric visits and procedures from nearby hospitals. We use data provided by the Hospital Service Area File and the Centers for Medicare and Medicaid Services. The brighter the color, the higher the competition. The degree of competition is based on whether or not a single hospital has a dominating presence in a zip code. If the largest market share of any hospital is 10%, then that zip code is considered highly competitive. We can show the number of discharges for pediatric cases, the total revenue for pediatric cases, and assess the number of days of care. We have only touched upon some of our capabilities and look forward to working with your group.